Hello, everyone. I'm Lana. Thanks so much for joining us. The United States has now administered over 400 million coronavirus vaccine doses. The pace of first doses has increased in recent weeks. More than 65% of the U.S. population has had at least one shot, and just over 56% are now fully vaccinated. But some states are still lagging behind. Idaho is one of them. Jonathan Vigliotti is there. For more, let's bring in Dr. Brandi Freeman. She's an assistant professor of pediatrics at the University of Colorado School of Medicine. Welcome, Dr. Freeman. So on a national scale, the average pace of first doses has accelerated for the first time in months. How helpful have vaccine mandates been in overcoming vaccine resistance?
Thank you for having me. I think the vaccine mandates have made several people think critically about this vaccine. I know it's created some uncomfortable conversations, but in terms of the healthcare setting and getting us where we need it to be to care for our patients, I'm a pediatrician, so in particular, most of my patients cannot be vaccinated. I think it's been a really important factor in moving us along through this pandemic.
I also want to ask you about what we heard in Jonathan's reporting. With these mandates, there are more people getting vaccinated, but that doesn't necessarily mean that their minds have changed about vaccine hesitancy or the misinformation that has proliferated and informs their feelings about vaccines. Are you seeing among your colleagues the same level of vitriol coming from people to add to the burnout that so many healthcare providers are already feeling?
Not to the extent that I think that they're seeing in Idaho. I think amongst our colleagues, I'm in Colorado, and Colorado's system that I work for was one of the first in the country to do a vaccine mandate. And so we've had a lot of time to think about it, to talk about it. I think it's always key to talk about this in the sense of vaccine hesitant and vaccine resistant. And I think when someone's hesitant, that means they have questions. They have more information that they need. And I think it's our job as healthcare providers, it's our job as human beings to try to figure out what that is and how we can get it for them.
Well, federal health officials will be meeting soon to discuss Pfizer's pediatric vaccine. As a pediatrician and as a mother, I'm interested in hearing your take on this in particular, because this is going to affect kids ages 5 to 11. The FDA is going to meet first. The CDC then follows about 2 weeks later. What are you looking to hear from the experts?
I'm very excited about the possibility. I'm hoping it is going to be full steam ahead. For vaccinating children 5 to 11. I think children need to be in school. And as a primary care pediatrician, I've answered a lot of different questions about this vaccine, what it could do for children, what it could do for our community. And I think there is positive information there. And the ability to vaccinate kids can help us move forward through the pandemic, can help keep kids in school and prevent the serious complications that are the scariest part of the COVID-19 pandemic.
FDA official Peter Marks acknowledged that there is a growing concern that a recent drop in cases is now starting to level out, and that, quote, maximum vaccination might be needed to actually get the pandemic under control. How important is vaccinating young kids to that goal?
I think it's critically important. There is a study that was recently released that did talk about the fact that children are infected at essentially the same rate as adults. And so the key point in that study was that children may be more likely to be asymptomatic. So if we're really going to get a hold of this, we need to get a hold of the pediatric population as well in terms of vaccines to prevent spread, to prevent exposure, and to prevent mutation of the virus further.
And that's the JAMA pediatrics study that you're referencing, right?
Exactly.
So tell us, explain to all of us why it's so problematic if kids are asymptomatic and the folks around them aren't vaccinated, or they aren't vaccinated yet.
So the way I think about it is, if you have an asymptomatic child who goes into a classroom with 20 other people, or 20 other children. They may not necessarily bring it home to themselves. They're not showing symptoms. But if they give it to one of their classmates who gives it to their grandmother or who's unvaccinated, or gives it to another adult or to their teacher, we just continue to see the spread. And so in terms of getting control of the pandemic, getting control of the infections, they're going to be an important population that we need to vaccinate. And I'm really hoping that the FDA and CDC come back with some positive information in that regard.
I am hoping for that as well. Dr. Brandi Freeman, thank you so much for joining us, and thank you for all that you do.